Yes, so this is going to depend patient to patient because it's not so much like just getting the stones removed, but will you likely need to have your gallbladder removed or what's called a cholecystectomy. It just depends on like your symptoms, your pain, what's exactly going on. But I have had a number of patients in like the 8-9 years I've been practicing, however long, that have needed to have a cholecystectomy because they had gallstones that then led to a blockage. And in situations like this, it is not an OBGYN that takes out your gallbladder, it's a general surgeon. And there are guidelines in place on like the best time to do surgery when someone is pregnant. And again, same with like appendicitis, like if you need to have your appendix removed, like and you're pregnant, if it's an emergency, like you're gonna get it removed because that could be life threatening, right? But if it's something where like you can time it as far as like the best possible time to have surgery when you're pregnant is going to be in the second trimester. And same with just like the location, right? Your gallbladder sits up here, tucked in underneath your liver. And in the second trimester is the best time to do surgery. Your uterus isn't all the way up and in the way. So a lot of the times the general surgeons are able to do it laparoscopically, meaning they don't have to do a big incision, just little port incisions with a camera and take out the gallbladder that way. Same with like the appendix. In the first trimester, you try to avoid it just because of the general anesthesia and stuff like that. But again, in an emergency, it's an emergency, so you have to do it. But if you can time it, second trimester is the best time to operate on a pregnant person. And yeah, like the uterus is up out of the way far enough. Have I had patients need to have surgery in the third trimester for whatever reason? Yes. But the best timing is going to be in the second trimester. But this just depends patient to patient circumstances. Is it an emergency? Can it be planned? Does your general surgeon feel comfortable doing surgery in someone who's pregnant? I've met some that just don't feel comfortable operating on pregnant people, so might have to find another one. But anyway, that's usually more rare. But yeah, it just depends. But yeah, I've had patients that have had to have that happen.